Good morning. This is Dr. Beck here at Life Medical. It is November the 5th of 2021. Give you a brief update on what's going on and wish you a good weekend. Looks like it's going to be nice weather. It's going to be cool but clear. So I'm excited. It'll probably be a beautiful, beautiful weekend in this county. As far as COVID goes, it's still in the community, still roaming around, still have a bucket load of people who we're helping and monitoring through this disease. So just remain vigilant and try to avoid this thing as you can. I am concerned. I do believe everybody's going to get this eventually, and it looks that way because of the way it's these waves of things going through. So just think about that when it comes to the vaccination, okay? Because a lot of the sickest patients I have right now are not vaccinated, and and not all of them are just rebels. Some of them I didn't feel like were good candidates for the vaccination. And talking to them, but for the most part, I think everybody should get the vaccination particularly if you're at high risk. I want to talk about shingles. Let's talk about shingles. Shingles is a rash due to a herpetic infection, or herpes virus, and it's called it's the same virus that causes the chicken pox. Okay, and usually we have chicken pox when we're kids, and I even have a little scar on my face, I think, where I had chicken pox when I was a child. I actually remember playing with a bunch of kids that had bumps all over them and wondering why they were letting us do that, and it was because that's the way we did it back then. My mom was immunizing me or vaccinating me for that virus. So as you get older, a lot of times there will be circumstances where this virus will come back out. It'll come back out as a rash, and that rash will look like this. It'll be red, it'll be itchy or feel irritated, maybe not necessarily itchy, more like scratchy, I guess would be more of the way it feels. And it'll have little bumps on it. It'll have bumps, and it'll also be in one little region, like it won't be all over your body. It'll be just on one, what we call a dermatome, or one nerve distribution. Okay, and the key to shingles is early treatment. Like, we want to get to you within a day or two of you having this pop out. Okay, and sometimes it's hard to tell. Now, usually as a doctor, we can tell from across the room when we see shingles. But if you have a little patch of red bumpy stuff that comes out and it's scratchy, I want you to try to interface with the medical community at that time, including us, and we'll see you promptly. The reason why is because if you get to it early, you don't have the pain that a lot of people have after they've had this virus. And the pain is called post-herpetic neuralgia, and it's severe, and it presents a big problem to people after the shingles is already gone and taken care of. So that's what we try to stop, and sometimes it can be very serious and even fatal at times for some people. So, and I'll know hairdressers and barbers, they've sent me several patients in the past because they saw the rash and they knew what it was, and they told them to come straight and see me, get them taken care of. And I actually appreciate y'all doing that, because that seeing it and getting it early on is the key. Now, one way to prevent you from having shingles is to get the vaccination, and it's indicated for anybody over 60. It's called Shingrix, and it is a 2-step vaccination, and it works really good, and I think it has really good data to back it up. The old one, the Zostavax, is still considered adequate when it comes to shingles, and I pushed that one for years, and it was very effective. The only difference, I think, with the Zostavax, the older one, is sometimes you would get shingles that would pop up and then it would just melt back away, and so you still didn't have all the pain and all the complications you have related to shingles. So if you ever think you've got shingles, you have that rash, pimply rash pop up that's scratchy, come and see us. If you're eligible, talk to us about the vaccination when you're in here, and we'll get it all ordered up for you, get you taken care of. And I believe it's a safe vaccination. Hadn't heard a lot of negative feedback about it ever. All right. Oh, one more thing. One more thing. If you like cookies, okay, and honestly, cookies is one of my favorite vegetables. Chick-fil-A has a month. This month, anytime somebody buys a cookie, they'll make a donation to a portion of that to Place of Hope, North Georgia. So, from what I understand, for the month of November, if you buy a cookie from Chick-fil-A, Place of Hope will get a donation. So, I'm a big fan of cookies. I'm probably going to buy some this month. But if you have a hankering for a cookie, don't eat too many. Go to Chick-fil-A and get one. All right. And I appreciate them doing that. That's very generous. Thank you so much for listening to me. Have a great day.